Okay. Good afternoon, everyone. My name is Fiona. I am part of the Fast Prep team at the Desmond Tutu Health Foundation in Cape Town. And I'm going to be talking about barriers to STI partner notification identified and experienced by young women and healthcare workers in Cape Town, South Africa. I'd just also like to say that this was in partnership with the Indlela team based in Johannesburg, South Africa. So a little bit a background to our study. South African clinical guidelines for STI treatment and management recommend that all who test positive for STIs should be provided with a notification slip for their partners. Despite these guidelines, though, STI partner notification and treatment rates remain very low. Some of the barriers to this include misinformation, so around transmission or symptoms, as well as interpersonal barriers such as fear of stigma, being accused of infidelity, physical violence from partners, as well as a reluctance to notify multiple or casual partners. So the aim of this study was to explore the barriers and facilitators of STI partner notification and treatment using a nudge framework in a group of adolescent girls and young women, or AGYW, from Cape Town, South Africa. We used a behavioral design approach to identify challenges experienced by AGYW in notifying their male partners about a positive STI diagnosis. So we had 7 AGYW who had been in a recent STI study with a STI positive result, and 8 healthcare workers attending a behavioral mapping and co-design workshop in Cape Town, South Africa. During the mapping exercise, we explored the insights and barriers and solutions for the PN process. So I know this is very small, but this is just an example of what the current partner notification slip that we are using at the moment looks like. It is an A4 size piece of paper, and at the top it is asking the partner to go to a clinical service, so one of the clinics or the mobile services for treatment. It has it says it in 3 different languages, and it also has a section at the bottom for the health worker just to say what treatment the partner should be getting according to the STI. So in general, the AGY and healthcare worker insights were actually quite similar, just in terms of their experiences. So for the AGYW, they were often uncertain where they got the STI from and when. They had a lack of knowledge, like around what is an STI, for example. They had different beliefs around whether treatments are effective or not. They also had fear around what if or can you have a child? Did they have HIV as well? And will the medication work? They reported that they don't receive counseling around STIs or guidance on how to inform their partner, and often had a lack of motivation to notify their partner. And they mentioned partner reactions quite a lot in terms of potentially losing a partner, interpersonal violence, as well as, especially if the partners don't have symptoms, which, as we know, is often the case. And then with regards to the design of the slip, they said it was complicated and too big, which we kind of have seen as well. And then the health workers, they said that they're often in denial. The AGYW are often in denial after receiving the results, and they're often not absorbing the information from the healthcare workers, especially when there aren't any symptoms. And this is often as a result of together with when the AGYW attend the clinic for another reason, for example, like for family planning, it's difficult to accept that result as well. They have limited understanding of STI treatments, like are they curable or not, fears of how it impacts fertility. And the healthcare workers really felt that they need to feel empowered to have the right conversation with the participants based on each person's individual history. And they need to be able to discuss ways to disclose other than using the slip. And then again, the feedback was that it looks like a legal document and it's intimidating. So we divided all of these insights into 3 barriers, namely the diagnosis, the treatment and counseling, and then the partner notification. So these are just some quotes to add on to each barrier. But with regards to the STI diagnosis, a young woman said, "I don't think I have an STI, I have no symptoms. I don't believe I got this infection from my partner. It must have been from a toilet seat, for example. With the treatment and counseling, I'm scared my partner will blame this on me. The PN slip indicates the specific STI. That's my own personal information." The healthcare worker said that the PN slip is too complicated, too much text, and I don't have the right tools to counsel the patient on partner notification. And then with the notification, I don't know how to start this conversation with my partner. I don't feel like I can convince my partner to go get treatment. And lastly, the healthcare worker said, "I wish someone else could notify the partner." So some of the suggestions from both groups, they wanted to remove the AGYW from the process altogether, and have a simpler slip, and wanted to train healthcare workers to counsel and equip AGYW around notifying their partners through education and counseling, and having a plan for communication. So they came up with some prototypes. I haven't put all of them there, but a lot of them were around expedited treatment, partner treatment, which was mentioned before. And but here are 2 of the examples. They wanted a user-friendly slip, more like an invitation card. They wanted express treatment for the partner, and courier treatment for the partner, which means that the partner doesn't have to physically attend the clinic. And videos used for counseling, etc. This is just my colleague presenting, one of the healthcare workers presenting their work. And so lastly, for future work, we have run similar workshops with male partners just to receive feedback regarding the prototypes, and we plan to incorporate this feedback. They had quite a lot to say. They didn't actually agree with some of the prototypes and wanted to change them a bit, so it was really informative. But we plan to develop high fidelity prototypes and then eventually have an RCT to test the acceptability and the feasibility of these prototypes compared to the standard of care. Thank you very much.